Hello everyone. Today we are here to discuss about the importance of prostate cancer screening. So before we go to the nitty-gritty of the topic, let me tell you some facts about the prostate cancer. Prostate cancer is one of those cancers which has a 100% cure rate if we detect it early, like in stage 1. But if we detect it in stage 4, then the survival dips down to 28%. So hence lies the importance of prostate cancer awareness to detect it early. Now back to the basics. What is a prostate gland and what does it do? Prostate is a very small gland lying just below the bladder, and what does it do? It helps slightly in formation of the semen, and semen helps in sperm health. Why it is important to know about prostate cancer? Because prostate cancer, if you see the statistics in United States, about 1 in 6 patients will have the prostate cancer in their lifetime, and if they have a family history of prostate cancer, like cancer in the brother, in the father, or in son, or in the uncle, then 1 in 5 patients will develop prostate cancer. In India, about 15 lakh patients are diagnosed with prostate cancer every year, and it is projected that by the year 2020, it will double. We were comparing the data from US and India. In US, 85% patients are diagnosed in stage 1, that is that they can be completely cured. But in India, 85% patients are diagnosed in stage 4, that is we cannot cure them completely. That's the reason we need to catch prostate cancer early. Here comes the importance of prostate cancer screening. So what is a screening? Screening is to do some test for a disease when there are no symptoms, and it is very important for prostate cancer because prostate cancer is a very slow growing cancer, and when it is still in the prostate or localized, then there are no symptoms. So you have to get yourself screened when you have no symptoms. So who are the patients who need prostate cancer screening? If the patients are men within the age group of 55 to 69, you need to get yourself screened. If you are within 40 to 54, then you need screening if there is a family history of prostate cancer, or if you are more than 70 years of age, you don't need to get your screening done. But if you are healthy, it is expected that you will live for 10 to 15 years, and maybe you are on 1 medications, you can get yourself screened. If you are less than 40 years of age, prostate cancer screening is not recommended. So what are the tests we do for prostate cancer screening? Is a blood test and a physical examination. Blood test is known as a PSA test, that is prostate specific antigen test. It is a common idea that if the PSA is less than 4, you are safe, which is not always true. PSA can be elevated because of many reasons. It depends on the size of the prostate, age of the patient. So once you get the PSA done, it is always better to get yourself evaluated by urologist or rather uro-oncologist, who will interpret the test results and also do a physical examination. And if he or she finds any abnormality in the PSA test or the physical examination findings, then he may order advanced imaging studies like MRI scan, or he may advise prostate biopsies. Prostate biopsy is taking some samples from the prostate gland, and the pathologists see those under microscope to detect prostate cancer. Now, if prostate cancer is detected, don't despair. If it is still in the prostate, as I have already mentioned, that it can be cured completely with the advancement in the surgery or the radiation, the patient lead a normal life. Talking about surgery, in 2021, we have robotics with us. So if the patients undergo robotic surgery, there will be less blood loss, less hospital stay, and they can join work early, and they have better oncological outcome. So you can definitely go for robotic surgery and also for radiation therapy if the prostate cancer is detected and it is still in the prostate. And now I always get this question that is there any way we can prevent prostate cancer? There is nothing as such, but just lead a healthy life, do exercises, avoid smoking, and eat a balanced diet that can help you to prevent prostate cancer and other cancers also. Now, what are the advantages of doing prostate cancer screening? The advantage is you are detecting the prostate cancer early when it is still curable, and if the PSA test comes out to be normal, then you are in the peace of mind. But as you know, every good thing has its own disadvantages. The disadvantages of screening is that if the PSA is elevated, it can be elevated because of other reason like enlarged prostate or inflammation in the prostate like chronic prostatitis. So that may confuse the patient or the individual. And secondly, the PSA can be negative and there is prostate cancer. So there is a chance of missing prostate cancer by merely doing a PSA test. That's the importance of seeing a urologist or uro-oncologist once you get a PSA done for the physical examination and for the interpretation.